So in this video, I'm going to talk about 5 emergency situations that are often missed by patients and families. And hopefully, if you watch this video, you won't miss these in the future. So I'm Dr. Matthew Gloudeman. I've worked in multiple hospital specialties from general surgery, orthopedics and trauma, palliative care, old age psychiatry, general practice, urgent care, acute medicine. These are the emergencies that I often see over and over again that people delay getting seen for that could be life-threatening or problematic. First one, black stools. So what do I mean by that? Blood mixing with stomach content turns black. And if that's happening, that means a bleed from your stomach or your small intestine. That is a huge worry. That is a medical emergency. You need to be going to the hospital for that. So blood mixing with stomach content, it kind of creates this black, sticky, kind of tar-like substance. So people often think, oh, I ate something odd or whatever, but most people will understand like big volume blood coming out one end or the other, meaning you're vomiting. They're worried they get to the hospital. But black coffee ground bits in a vomit or black sticky tar-like stools is a huge emergency. We call it an upper GI bleed, gastrointestinal bleed. If that is happening for you, please go to the hospital straight away. The things that can make that happen, sometimes if you're a heavy alcohol drinker, you might be bleeding from like veins in your esophagus. If you're having an ulcer in your stomach, risks for ulcers are things like smoking, alcohol, spicy foods. You could have like fizzy drinks, caffeinated drinks, things like that that can increase the risk of reflux symptoms. Also, there's drugs like non-steroidal anti-inflammatory drugs like naproxen, ibuprofen. Those can irritate your gut lining. So if you're taking those consistently, again, these are all things that could contribute to a bleed in your stomach, which is a medical emergency. So if that's happening, go get seen. Second one that people often mistake or miss is dizziness of a very high severity. So there's lots of reasons for dizziness. Maybe I'll make another video about that on this channel. But the two types of dizziness that I worry about that need to go into the hospital, cardiogenic syncope, which is a mouthful, and a posterior stroke. So what's the first one? So your heart might cause you to lose consciousness. If you're feeling lightheaded, dizzy, and then you lose consciousness for minutes, meaning like 30 seconds to a minute or longer, that's not normal. You should be going to the hospital for that. Some people think, oh, I just was a little bit dehydrated or something like that. I need to like drink some more water. If it's happening for seconds, like 10 seconds or something like that, maybe. But if you're losing consciousness with dizziness, palpitations, this is a medical emergency. You need to go to the hospital. Second one, sudden onset severe dizziness. And people often mistake this for a lot of different types of dizziness, sometimes from your heart, from your blood pressure, from your ears. Having worked in acute medicine, so it covers most of the dizziness, and ENT, it's easier for me to distinguish the differences between what's a worrying dizziness or not. But the one that we worry about the most is a posterior stroke. So a stroke from the cerebellar area, the back of your brain. And if you're having sudden onset severe dizziness, you can't walk around, and that's lasting for a good duration. And by that, my rough guide is about 15 minutes. You may also have other stroke-like symptoms, so visual change like one-sided visual loss, curtain coming down or across your vision, slurred speech, facial droop, one-sided weakness. These are all signs of a stroke. But even isolated severe dizziness that's lasting persistently for a decent amount of time that you can't explain, that kind of came on like that, that's a big worry. You need to be investigated. Sometimes it's other related issues like problems with your ears, like the vestibular part of your ears, which can cause this type of dizziness. Some people get vestibular migraines. But the big thing is, if it's severe, sudden onset dizziness, mark down the time. Anytime you have a stroke, you want to know what time it is and get yourself to the hospital. The next one, bites. A lot of times people don't realize how severe bites are. It doesn't matter if it's a dog, a cat, a bat, whatever, even a person, if you like nicked somebody's mouth with your hand or whatever. Bites can cause deep-seated infections. I often see people get bit by something, are delaying getting seen, and then they're having problems and they can get deep-seated infections. We're often giving antibiotics for people that are getting bit by something, especially if it's breaking the skin. So certainly severe bleeding where you can't control the bleeding needs to be in the hospital straight away for as well. But bites need to be tended to. You need to also know in your area what animals might have rabies. In the UK where I work, bats are the place where we worry about rabies. And then the other one would be like, which doesn't happen very often in the UK, any venomous animals. So if you can snap a photo of whatever bit you, it's useful for the doctors to be able to see what that looks like. Probably AI can run photo recognition of what that animal is as well pretty well at this stage now. But it's really important, if you're bit by anything, make sure you get seen. The next one, severe confusion. So new onset confusion can be a number of problems. Maybe it's because of a severe infection. We worry about sepsis, like a systemic infection that's causing confusion. So if you're getting like really high temperatures with confusion, or full body kind of teeth chattery shakes, these are concerns for a severe infection. Should be getting up to the hospital. We usually try and get antibiotics within an hour and taking blood tests, blood cultures, sending off urine samples, getting fluids in. So if you're having severe signs of confusion, the other thing that could drive confusion is certain medications could cause confusion, and electrolyte abnormalities, which can be life-threatening as well. So things like really low sodium, high calcium levels, these can all affect your ability to think. The other one will be liver failure. Sometimes you have like encephalitis secondary to liver failure, or things like meningitis that can cause like inflammation around the brain cavity that can cause confusion. So getting severe confusion. Now, the trickier part with this, having worked in old age psychiatry, is confusion in someone that has cognitive impairment or dementia already. And that's a bit of an area of gray. So if you're not sure, just get seen and talk to a healthcare professional, because again, these videos are for education purposes. So if you're not sure about whether this confusion is new or not, better to get seen, get assessed, and then make a judgment call whether you got to escalate to the hospital or you can manage in the community. The last one, severe headache. So headaches are very common. The headache we worry about the most is a bang, sudden onset, severe headache, like 10 out of 10, worst headache of your life. Why is that a big worry? Because that could mean an intracranial bleed. The other problem with severe headaches is if they're starting to cause focal neurological symptoms, we tend to worry. So what do I mean by focal neurological symptoms? It's a mouthful. It means things like slurred speech, facial droop, one-sided weakness, visual changes. If you're having dizziness or kind of problems in sensation with a headache, that's a problem. Some people get vestibular migraines, which are a little bit different. Vestibular migraines are sometimes you get a headache with dizziness and you're going to go in a quiet, dark room. But if you're having a very, very bad headache, the worst of your life, that came on within 5 minutes or so, that makes me much more worried than a headache that kind of builds up over time. But anytime you're getting neurological symptoms with a headache, you need to be seen, sometimes straight away in the hospital, like this bang 10 out of 10 headache, sometimes urgently with your own GP or an urgent care setting. If you're getting focal neurological symptoms, there's a bit of gray area which place you should go, but certainly you need to be talking to someone same day about that. Hope this video helped you understand some of the missed problems that can be life-threatening. There's more videos on this channel if you're interested. Thank you.